The London Bridge Sports Medicine Podcast.
Medical news, health, fitness.
With Dr. Ajai Seth.
Hi, welcome back to the London Bridge Sports Medicine Podcast. Today I'll be speaking to Dr. Seth, who'll be answering all your knee brace questions. Why do I need a knee brace? What different types of knee braces are there? And are there any medical conditions that can be treated with a knee brace? So stay tuned and happy listening. This week we're going to be speaking to Dr. Ajai Seth. Would you like to tell us a little bit about yourself?
Yeah, so I'm Dr. Seth. I work at London Bridge Sports Medicine as a sports medicine doctor here. And yeah, thanks for having me on. Looking forward to talking all about knee braces.
Why would someone need a knee brace?
So that's a great place to start because it's not always obvious, is it? So I think the usual example is someone has an injury and they think, oh, my knee doesn't feel right. It feels a bit wobbly or it's a bit swollen. So the automatic thing for someone to think to do is to go on some form of online shop and buy a knee brace. So I guess you can kind of break it down into braces that help injuries. So you've had an injury to the knee and you need some support, but also there's a big group of braces that help longer term conditions like wear and tear off the knee or arthritis. And also there's another group of braces that help conditions from, for example, if you've had surgery and you're rehabilitating after surgery. So there's lots of different reasons why you might need a knee brace. So I think the best thing to do if you're not sure is to either ask your local medical or physiotherapist to understand what you're trying to use the knee brace for, really. And also have a good idea of what the purpose of the brace is. What are you trying to get out of having the knee brace? Is it a supportive thing or is it a functional thing? So, lots of different things to ask yourself before you get a knee brace.
Are there different types of knee braces?
Yeah, there's loads of different types. And again, there are all different types of shapes and sizes, custom made ones, off the shelf ones, ones that could be fitted by yourself, one that needs to be fitted by an expert. So again, it gets very complicated out there, and it's a bit of a minefield, for patients sometimes. They're trying to navigate themselves through the world of knee braces, and yeah, it's difficult to sort of to find your way sometimes. And I think if for a patient, probably the first thing to understand is what is wrong with my knee, because actually the anatomy of the knee and the area of injury, if you know that, then you can know what type of brace you may need. So for example, if you're someone who's got kneecap pain, you might need a completely different brace to someone who's got a meniscal injury, which is the shock absorber within the knee. So you need to understand what the injury is, and again, like before, what you're trying to solve from that point of view. You can categorize knee braces other ways. So things like you get braces with hinges or without hinges. You can get braces where you set them, so you can set how much flexion or extension they can give, or how soft or rigid they are. How much force they're absorbing or how much stiffness they've got. So, there's loads of different types of braces, and it all depends on what the sort of condition is.
Would you say it was easy to go out and buy the wrong sort of knee brace?
Yeah, and I think most of the patients I see with knee braces have literally just slapped on something and they have no idea, but it feels good. It feels good wearing something around the knee because, there's that supportive element to it, and it's feeling, if you've got a sore knee and you're just sort of putting a nice pressure bandage on it, it's going to feel better. But at the end of the day, I don't think it's providing the full function of what you want it for. So yeah, and like I said, most people go on Amazon and buy one off, the first one they find, or Amazon best choice or best seller, and it's obviously not going to be a one size fits all. So I think you often see people coming with completely the wrong type of brace for what they're trying to do, and sometimes actually wearing the wrong brace can make things worse. It can aggravate the knee and make the knee just a bit more inflamed. So yeah, it's always worth understanding the background injury to the knee.
What sort of medical conditions could be treated with a knee brace then?
The best way to sort of describe them is to break them out into acute or short-term injuries and then longer term injuries. So if we start with the acute injuries, you've got things like ligaments you can sprain. So the classic examples are things like your MCL, which is the ligament inside the inside of the knee, or the medial collateral ligament, which it's actually called. And then the ACL, the anterior cruciate ligament. They're really common ligaments to sprain, ski injuries and football injuries and that kind of thing. So if you have a sprain of that type, or a ligament injury of that type, sometimes you need the brace to help stabilize the knee. So it's like, the ends of the ligament are trying to heal and the knee just hasn't got that stability. So that's what that type of brace is for. So that's an acute ligament type injury. So again, very specific type of brace, very specific types of settings, usually require a medical professional to sort of fit them from that point of view. Other acute injuries, things like meniscus. So you can have a meniscal tear. So that's the shock absorber within the knee. In that case, you might want a bit more of restriction on the range of motion, because it's like, okay, you don't want to put the knee throughout all the range of motion. You don't want to really put deep flexion, for example, where the knee is quite bent. You want to avoid that. So you can set the brace to say, all right, I want to go from 10 degrees to 90 degrees flexion, but not let it go around that range. So you can really protect the range of motion from that point of view. So that's another type of acute injury. Other types of acute injury include like bone and fracture. So often you get a certain type of brace that you can wear once you've had a fracture, semi like being in a plaster of Paris, but it's a different type of knee brace. And that's very commonly used in fractures that often are coming out of the plaster of Paris. So you might have had the plaster in Paris for 4-6 weeks, and then you go into a brace thereafter. So it's like that transition out of the plaster of Paris. So that's kind of, a brief overview of all the acute braces. And generally they need some medical attention. I think if you've sprained your knee and it's a little bit swollen, it's a little bit puffy, then yes, maybe things like tubey grip, or sleeves or neoprene sleeves you can buy online, maybe they might add a bit of support, but they're going to be restricting the way your knee moves and the way the muscles and tendons are firing in the knee. So there's certainly a lot of long-term solution. I really don't like when I see people on the golf course or tennis court with these knee braces on, because it's like, why are you wearing that long term? What are you trying to achieve? Or that is that the right brace for you? And often it just becomes habit, doesn't it? So anyway, that's the acute types of braces, and then you get the chronic braces. So these are the ones where you're trying to change the biomechanics of the knee. So probably the best example of that is you've got some wear and tear in the inside of the knee. So for example, there's been a cartilage injury, or there's a bit of arthritis around the inside or the outside of the knee. So you can buy braces that help shift the force, so your center of gravity, from one compartment to the other. So either from the inside to outside, or outside to inside, or front to back. So all that's possible with a brace as well. And it used to be that people jumped straight to surgery and had knee replacement, but actually now the braces have come so good, you can kind of modify the force going through the knee, along with all the rehabilitation and physiotherapy and all that kind of stuff as well. So yeah, I think it's best to kind of split the conditions into acute and chronic, and then get a better idea of what brace you need.
How would I go about getting a knee brace then? What would be the best route to go down?
The best thing to do is really speak to someone first. I think if you're going to have a quick £5-10 investment on Amazon, that's not a big deal. But it's heartbreaking when people spend sort of couple hundred, £200-300 on a brace they think looks good or has good reviews online from a physio group or anything like that, and actually it's completely the wrong brace for them and the wrong size. So I think before you go down that path, it's certainly worth asking for medical help from that point of view, and like I said, understanding what the condition is and what you're trying to achieve with the brace. I would say good braces are an investment. it's something that you're going to need to spend a bit of time, a bit of money, and a bit of investment, but it's the kind of thing that will last you. So once it's fitted, you've got it. You've got it for every time you go skiing, or every time you want to go for a long walk and you feel you want to protect the knee, that kind of stuff. They're going to be there for you to exercise with. So yeah, it's certainly worth getting some advice before you buy one. And yeah, but like I say, the clinic we run is very used to guiding through patients through that kind of journey from that point of view. But it's not just knee braces, right? It's actually the same principles for ankle or any other joint. But I think the knee braces are probably the most common braces we see out there. So it's certainly worth getting some opinion before you get them.
If anyone has any questions or wants to get in touch or feels like they might need a knee brace, feel free to get in contact. But otherwise, thanks for joining us on the podcast today.
Thank you so much, Bella, and hope to see you soon.
Brilliant. Thank you.
Bye.